I would like to introduce Professor Ashok Agrawal with presentation sperm DNA fragmentation, why it is controversial, and what should be the clinician be doing. Thank you, and please, Professor.
Thank you very much, Professor Huang. Thank you to our moderators and distinguished guests and the members of the audience for this wonderful opportunity for us to share some of our knowledge and experience with all of you here in Vietnam. We are very thankful for this great opportunity. So without any further delay, because the time is already moving here on the slides, let me see. So my talk, actually, Dr. VD completed my talk already on sperm DNA fragmentation. It was Dr. Garmer who saved the day. Otherwise, he would have eaten my lunch, and there would be nothing for me to speak. So thank you very much, Dr. VD. So we are going to talk a little bit about the controversy and what the clinician should be doing. I have no potential conflict of interest. So today, we're going to talk about what is sperm DNA fragmentation. You heard from Dr. VD's talk already some of the things. And talk about SDF, or sperm DNA fragmentation, and human fertility relationship with varicocele and reproduction, SDF testing, which you saw in some of the slides from Dr. VD, what to do with increased sperm DNA fragmentation. Perhaps we can talk a little bit about some other things, and touch upon the clinical guidelines that we just published on sperm DNA fragmentation and its role in male infertility. These are the guidelines that will be elaborated tomorrow during the morning session. So I'm going to just touch upon it, but not go into too much detail. So this is the plan, and I know I have very little time, so I need to be fast. So just to tell you about sperm DNA fragmentation or DNA damage, it's a very broad term, and many people are not familiar as to what is DNA fragmentation. And I think this slide illustrates that there can be a number of changes in our chromatin, which will all be considered under the term DNA damage. So we can have DNA fragmentation, which has a very high rate in infertile men of almost 50%. Then in azoospermic patients, we have Y chromosome microdeletions. We have other changes that we see in mitochondria and others, which we don't know the incidence of these kind of damage to the DNA, because these are not studied so much, and there are not too many good diagnostic tests that are used clinically in a routine manner. So there is a lot of work which needs to be done to understand other types of changes in the DNA. So more importantly, we are going to talk about, when we say sperm DNA damage, you should only think about sperm DNA fragmentation, especially for patients with male infertility, except those we talked about Y chromosome microdeletion, which is a very special kind of patients there that many of you are familiar with. So sperm DNA fragmentation is a marker of damaged chromatin in sperm, which includes a variety of changes, which can include single or double strand break. It can include other smaller changes in the bases, deletion or modification, and protamine deficiency. And these collectively are resulting in what we call as sperm DNA fragmentation. So just for you to kind of remember what is sperm DNA fragmentation, and we are going to talk about its role in various types of assisted reproduction. There is a meta-analysis that I talk about, which was published many years ago, and you can see that even though the number of studies is very small, only 3, but there is, I think, what you have to see that there is a large confidence interval per single study, which shows poor precision. High sperm DNA fragmentation by a test called sperm chromatin structure assay is related with failure to achieve natural pregnancy. And that is the main thing. But the study, the meta-analysis, has many limitations. Then we have this study on sperm DNA fragmentation and recurrent pregnancy loss. These are all meta-analyses that we are talking about. This is from Dr. Tan. I don't know whether our Dr. Tan is here. Is this your study? I don't know. But it was published in Reproductive Biomedicine Online. And it included almost 13 studies, as you can see. The couples with a history of idiopathic recurrent pregnancy loss have higher level of sperm DNA fragmentation, as you can see here, which is showing that looking at all the studies, all 13 studies, when they were meta-analyzed, that we found that there is a significant increase in the level of recurrent pregnancy loss in these couples. So this again is another evidence here. This is a recent meta-analysis that was conducted by our organization, Global Andrology Foundation, and maybe some of our colleagues here in Vietnam may have participated in this. I don't know now, but it includes the results from 40 studies that have been published in the literature. And what I want to report here is that men with varicocele show high levels of sperm DNA fragmentation than men without varicocele, with and without. So there is a significant difference. As you can see here, that there is a significant difference. What is more is that the testing by different types of techniques did not affect the results. So whether you are doing this type of test, SCSA or tunnel or comet, it did not make any difference. The results were pretty strong, as you can see here. When you see all these green dots on the right side, that shows that there is a significant difference. Next is the impact on IVF outcome, and you can see here that there are 4. This is again a meta-analysis which looks at impact of sperm DNA fragmentation on IVF outcome in terms of the pregnancy rate, which is really important for the patients because they are not always happy just to tell that there is a decrease in your semen quality. They want to know, what about the pregnancy? What about the birth rate? So all the things that are important for them to have a child. So we need to look at those data to see whether it really translates into an outcome which is important and clinically useful for the patients. So all these studies, as you can see, there are 4 different meta-analysis that we are talking about, and each of them have a large number of patients that are being included. And the main findings is overall that sperm DNA fragmentation damage is associated with low IVF pregnancy rate. Every single meta-analysis that have been done on almost 6,000-7,000 patients demonstrate that. You can see here impact of sperm DNA fragmentation on miscarriage and live birth rate. Again, an important thing. On the left side is the miscarriage rate. High sperm DNA fragmentation related with greater risk of miscarriage in 3 meta-analysis, as you can see here in this picture. This diamond is telling us, and the same thing here in terms of the live birth rate. So significantly lower rate in men with high sperm DNA fragmentation following IVF. This is the strongest evidence that you can find in a contemporary topic like sperm DNA fragmentation, even after taking into account all kinds of limitations that many of you or skeptics will have. But remember, these are not under the perfect condition. Some people may say, well, we have this limitation, we have that limitation. I don't agree, because more important thing is we are conducting these clinical studies on real patients. So we cannot control every single thing to make it like a rat or a mouse. So we will have some limitation which should be kept into the mind. And after that, still we can demonstrate that this parameter really has important value. We have these results on ICSI. ICSI, as you know, bypasses the natural fertilization process when you are injecting a sperm directly inside an oocyte. So this changes the landscape of assisted reproduction from a sperm which is swimming in a petri dish and then trying to enter into an egg in a conventional in vitro. Here in ICSI, the dynamics are different. So can we find the relationship in patients which are undergoing ICSI, because ICSI is the most popular form of assisted reproductive treatment for patients with severe kind of male infertility. So what did we find here? Look at the results, that we did not find any significant effect of sperm DNA fragmentation on clinical pregnancy. And you can see here, there is no clear-cut results, but there is a reduced pregnancy in high sperm DNA fragmentation. So the important word is high sperm DNA fragmentation. And this, as Dr. Vidi said, that there is quite a bit of controversy in terms of the clinical values of importance for sperm DNA fragmentation as to what will you consider as the gold standard, that this is the range above which the sperm DNA fragmentation is going to be really harmful, or it is going to lead to very poor pregnancy results. So this is still an open subject. And let's go to the next part, which is about sperm DNA fragmentation testing by WHO 6th edition manual. I might skip these slides because these were beautifully covered by Dr. Vidi, and I simply cannot compete with his beautiful slides because he is such a master in making the slides. So I give up here. So please, I will go to the next topic. But I just wanted to tell you just one thing. For many of you or some of you who are unfamiliar with the topic of sperm DNA fragmentation and must be thinking, what is it that this person, Agarwal, is talking about sperm DNA fragmentation to us who are really taking care of these patients? Why? Because there are some important points about this test which makes it completely unique test of sperm function, molecular function, that no other test in the world has ever been come close to it. So it is very, very important for all of you who are engaged in the field of andrology, especially in assisted reproduction, male infertility related topics, that you not learn about sperm DNA fragmentation. Because if you don't know, you will not be doing a good service to your patients because your knowledge is very lacking and you will not be able to help many cases of infertility which is related to sperm DNA fragmentation. So I'm going to skip some of the slides, but go to the next slide. These are issues that are from covered by Dr. Vidi in his beautiful presentation. So I think he talked about many limitations of sperm DNA fragmentation because it's a biological test. It is not something which is completely standardized, that you can follow each step in a precise, reproducible manner. So because of that, there are many limitations, many problems with these tests to completely trust their results. So also there is a difference if the test is being done by someone in Dr. VD's clinic and somebody who's doing it in Dr. Garmer's clinic, the results may not be similar on the same patient. They may be quite different if they are using different techniques, different standardization. So there is a host of problems in terms of the standardization, reproducibility, cutoff value, etc. And those are important. What is important are the indications for sperm DNA fragmentation. And these are some of the indications: unexplained infertility, idiopathic infertility, recurrent pregnancy loss. We covered that. We talked about the risk factor, advanced male age over the age of 40, 45, and many other conditions that you can see here. Those will be candidates. So now let's go to the issue of what to do when sperm DNA fragmentation testing, you have found a lab, you have found a clinic where you think they are doing a good job in terms of reporting the results, you trust them, and you have the results that they claim are high or under abnormal condition. What are you going to do? What are your chances? What is it that you can do and you should do? What are the choices? What will you tell your patients? So this is what we are going to talk about in the next few slides. So this is a topic which we have been very interested for a long period of time. So this diagram is a schematic diagram which illustrates the kind of choices that all of you will be able to discuss with your patients. So this is really some of the things were discussed today by Dr. VD in terms of the antioxidant supplementation. But there are so many other things that you can do. You can repair the varicocele, and that can bring down the sperm DNA fragmentation, improve the semen quality, and in turn, improve many of the outcomes of clinical outcome. You can use the ICSI. You can do sperm selection, which can select sperm with lower sperm DNA damage. You can retrieve, in some cases, where ejaculated sperm have very high levels of sperm DNA fragmentation. You can, in those cases, you can retrieve the sperm from the testis and use it for assisted reproduction, for ICSI. You can have lifestyle modification. Don't go to the bar. Don't drink so much beer or alcohol. You have to tell the patient. Reduce the weight. Dr. Saline is really a role model here. We have reduced abstinence. So this is something that seems to show an improvement in semen quality. Instead of between 3 to 4 days or more, WHO says between 2 to 7 days. But if you can find, at least there are many studies, and Dr. VD has published one systematic review on this topic last year, I believe, or 2 years ago, which showed that many studies that have been published in the literature that reduction in abstinence time can improve the number of total motile sperm and semen quality. And those sperm can be with lower sperm DNA fragmentation. So this is another possibility. Antibiotic for genital infection, which you are familiar with. So what I wanted to say, and hormone therapy, so there are several different type of choices that you can share. And here we have a slide which shows the relative reduction in sperm DNA fragmentation by variety of technique. From short abstinence, it can go down to about 25%, gradient centrifugation, swim up, magnetic cell separation, PICSI, physiological ICSI, IMSI, and testicular sperm. And you can see that there are many studies that have been published using different types of methodology, but the overall results seem to show that many of these techniques can reduce the number of or percentage of sperm with high DNA damage in the semen sample. And this is a study that we published recently, It is effect of varicocele repair on sperm DNA fragmentation and levels of seminal antioxidant capacity in infertile men. Actually, melanaldehyde, which is the lipid peroxidation capacity in infertile men with clinical varicocele. So this study was recently published from our center. This is a very comprehensive meta-analysis, and you can see that there are significant changes after or improvement after the varicocele repair, and that reduces, as you can see, the sperm DNA damage, reduces the sperm DNA damage, reduces the sperm DNA damage. So this is a powerful study, again, telling about the importance of varicocele repair. You can use antioxidant, which you have heard from Dr. Vidi, which can also help reduce these harmful oxidation reduction potential. It can also bring down the sperm DNA fragmentation in patients who have idiopathic male infertility. So this is a selected group of patients. These are not patients which have very clear-cut diagnosis. These are idiopathic male infertility. So there is important changes. There are various sperm selection techniques that you can see here, and they have been used by clinics around the world, and they have, most of them have beneficial effects. These are molecular techniques which have beneficial effects in selecting or preventing some of the sperm with high DNA damage from passing, and those sperm can, with the low DNA damage or normal DNA, can be used for assisted reproduction. So very quickly about the guideline, although we have tomorrow time for topics related to clinical guideline. So I want to thank my colleague, Professor Eduardo, for helping me with some of the slides because he had so many slides, I had to cut it down. This is really an important undertaking from the Global Andrology Forum, was to develop guidelines which are important on a very controversial topic. Sperm DNA fragmentation is one, although there are guidelines from AUA and EAU and so many other societies, but still there is a lot of controversies, a lot of gaps in terms of what to do with this, what to do with that. So we had a panel of experts, almost 100 experts who worked together for almost 2 years to develop these guidelines. So you can see, unfortunately, many existing guidelines for diagnosis and treatment offer inconclusive diagnostic and treatment pathway due to limited clinical evidence. And here we have sperm DNA fragmentation and professional societies. The guidelines from GAF really differ from clinical guidelines from other societies because they are based not only on a thorough review of literature, but also includes the evidence from our recent systematic review conducted under our very rigorous condition in the Global Andrology Forum and published. It also includes global clinical practice pattern identified through global survey conducted by our organization. This real-world evidence is especially valuable when literature is insufficient, allowing recommendations to be shaped by expert consensus from practitioners worldwide. How much time I have?
You're over time.
Oh, okay. Let's go to the last one. These are just, this is the distillate, as you can see here, that we have been working. So thank you very much, Eduardo. You have done a great job. But this is I want to show you, these are all published. These clinical guidelines are not just something of discussion. They have been published in the topmost journal in the whole world with the highest impact factor that tells you that what we are conducting is of the highest scientific excellence. So I believe we have only 1 or 2 slides, and I will finish. SDF can provide useful information in many of these specific clinical scenarios, as you can see here. And in terms of its clinical relevance, we have talked about poor natural conception, recurrent pregnancy loss, IVF, and ART complication. So I think we covered about the testing method through Dr. Vidi and management strategies which were covered. So I think this is my last slide, thankfully. Current GAF guideline guide clinicians and researchers in implementing clear management strategies for infertile men who need sperm DNA fragmentation. So I believe I want to leave all of you with the message that the topic of sperm DNA fragmentation is being heavily researched and studied and examined all over the world. What you see here is a distillation through a very nice microbrewery from Bologna, which distilled all these information into this secret sauce, which we are providing to you here. So please be open and accept these results because they are of the highest evidence. And I believe that will really help you enlighten yourself, all of us, with the knowledge about this enigmatic test and its role in male infertility. With that, thank you very much.